This program is brought to you in association with First National Bank of Botswana. Diabetes, cardiovascular disease, mental stress, hypertension, and many others are all common ailments that a lot of people know of all too well. These are called non-communicable diseases, or NCDs for short, and according to the World Health Organization, they kill 41 million people annually, which is an equivalent of 74% of all deaths globally. 86% of these premature deaths occur in low and middle income countries, making them the leading cause of morbidity and mortality worldwide. They not only place a significant burden on population health, but also impose an indirect economic burden through significant productivity losses via premature mortality, early labor force exits, and absenteeism, amongst a plethora of many other negative consequences. While these are very common, they tend to be shrouded by pockets of misinformation. And to help us clear some of these is pharmacologist and consultant cardiologist Dr. Kiran Bhagat, who will lead a series on non-communicable diseases over the next few episodes. Doctor, thank you so much for coming on First Issues and affording us your time. We are starting a series with you on non-communicable diseases, and on this segment we want to talk about them as a whole. So in the segment you could start off first by explaining what non-communicable diseases are and what the most common ones are.
Non-communicable diseases, are diseases that occur as a result of lifestyle. They're not communicated, they're not infectious, they're not, if we start with what communicable diseases are, there are things that a mosquito can give you malaria. It's what the bilharzia parasite in the rivers give you, bilharzia. It's HIV, it's COVID. So those are infectious diseases which can be communicated between people. Non-communicable diseases are diseases that cannot be communicated. You cannot give somebody diabetes if you have diabetes. You cannot give somebody blood pressure. Although, as we will talk in our conversation, these issues become debatable when we talk about, for example, you are the average of the 5 people that you hang around with. We know that if you hang around with obese people, the tendency is for you to be obese. If you hang around, it's called the social nodal theory, where if you hang around people that smoke, you tend to smoke. If you hang around people that drink, you tend to drink. So there is some element of grayness about non-communicable and communicable disease, but basically the World Health Organization defines non-communicable as something that cannot be communicated. And these are the diseases of lifestyle which really are germane to us, both in Botswana as well as globally.
So why do non-communicable diseases occur? I know you just spoke about them being a lifestyle issue. Perhaps you could explain further on what you mean by that.
They primarily occur as a result of the change in demography of our living patterns. How we have moved from the cattle post to the car, how we have become more urbanized, particularly in our country, how we have become more industrialized. We've been through various revolutions, as we call them. We call them the agricultural revolution, the industrial revolution. We're now going through the IT and soon artificial intelligence revolutions. And these all impact on how we conduct our lives, what we eat, how we eat, when we eat, how often do we eat, where do we eat. And these are the issues that pertain to lifestyle. And as a result, take, for example, the fact that, now food is not something that you go searching for or hunting for. You open the fridge and it's there. Mm-hmm. So, before you'd work for your food, you'd hunt for your food, you'd exercise for your food. In our situation now, you eat when you like and you eat what you like because things are brought in from various corners of the globe. I think the purpose of revisiting this is also to understand, to go a little bit upstream and say, why are these things happening and what is it that can be done? So it transcends, if you like, the individual, almost even the national issue, and becomes a political, governmental issue in terms of what is licensed, what is policed, what is restricted, what is banned, and who's allowed to advertise and when.
So who's affected by non-communicable diseases, or who can be affected?
Sadly, as in the time where we had more infectious disease, the people that are affected most are the poor, because they are much more susceptible to advertising, they're much more susceptible to mass marketing. And of course, with fewer pennies in their pocket, they have to maximize every single tebe to what they can afford. And we now know that with bulk industrialization, with factory farming, with processing of foods, the reason why foods are processed is to allow them to be stored longer. You know, a banana or an orange or some maize rots because it's alive. If it's dead, if it's been processed, if it's been boxed and cardboarded, it lasts a long time, and therefore it's cheaper. And as a result, because it's cheaper, people buy it. And so we now have people that are, if you like, overweight but undernourished, in that they are obese. But if you measure their nutrient values in their bloodstreams, they are deficient in micronutrients, in vitamins, in minerals, because they're eating processed, highly processed foods.
What consequences are we likely to see if this rise of non-communicable diseases is not addressed?
I think the consequences we are seeing already today, Ponanseka, we are seeing, you know, sadly, when we see a patient, for example, with high blood pressure, we know, as we've talked before, blood pressure is generally a lifestyle disease, and it occurs as a result of excessive salt intake, lack of exercise, obesity, tobacco, alcohol, and lack of sleep. By the time the blood pressure is picked up, it's often too late, in the sense that it has been through your body and caused, wreaked havoc. So we see patients, particularly out in our rural areas, late, where the blood pressure has been escalating. They've now got an expanded heart, they've got an impact on the kidneys, they've had a stroke, or they have heart failure. And so we're dealing with damage limitation. So unfortunately, the same applies with all the other diseases. You know, cancers come late because it's a lump, you ignore the lump, you can't go to the hospital, you have no transport. You know, some of our systems aren't in place to rapidly assess with a biopsy. Patients with kidney failure need to be seen by specialists. There are fewer specialists. So the ramifications of the complications we see almost behove us to go upstream as clinicians and as reporters to say, where do we start to prevent this? And I think the primary issue, particularly with our public, is that of health education, to get them to understand that you know, if you don't find time for disease now, you're going to get sick later. If you don't find time for lifestyle now, be prepared to get sick later. And the impact of that education needs to be felt, particularly amongst women, because it's the women of our culture that bring up children, that educate children, that often are the breadwinners, that often keep the children. So they continue to educate. So the girl child, if you like, which is why the WHO has emphasized that it's the girl child that needs emphasis in terms of education, in terms of security, in terms of managing them all the way through. The more you educate the girl child, the more likely it is that they will rise socioeconomically. So this is the reason why I think it's important to target preventive episodes, because by the time somebody comes in kidney failure, it's costing the nation, as well as the individual and the health facility, an enormous amount of money, you know, which could be better spent on prevention, whether it's reducing the cost of a bunch of tomatoes, or whether it's ensuring that we do a fat tax as well as a fizzy drink tax. You know, use that tax money for cheaper whole foods, you know, whole oranges, whole apples, rather than canned things and biscuits and boxes. So I think that's where the initiative should be, in terms of restricting the salt content of bread, the salt content of crackers, labeling foods, because, you know, in our country, as many on our continent, there are no strict regulations about food labeling, so people don't know what they're consuming. In terms of insecticides, fungicides, pesticides, what are we putting in our soil? What are we growing our vegetables in? You know, are we washing them carefully? Is the water clean? You know, do people have access to water? So, you know, it sounds very boring, but these are the things that have an impact at a larger scale, rather than managing somebody with a stroke who's on dialysis and is on multiple medication. You know, so this is the issue that we face in terms of the global impact of disease and lifestyle.
Lastly, Doctor, can non-communicable diseases be prevented? And most importantly, how?
I think, you know, we need to, I look at Botswana almost like it's the 18th century wrapped up in the 21st century. You can go from the cattle post to the car within 45 minutes. You know, so you can go into a rural area and then go into a highly industrialized, civilized, and sadly Americanized culture within 45 minutes. But at the same time, we need to embrace the technology that has come in the 21st century. And we are doing that in our health systems where, for example, we can empower our elderly to use a cell phone. To communicate, to use apps, teach them how to use apps, to say, okay, on this app, send your blood pressure to us. There are apps now that can record your ECG, that can record your sugar, and can transmit that to a health facility or to a clinic or to a doctor to say, this is what's going on. So people out there in Etsa and Chakawe and Saronga can actually now communicate, whereas before they'd have to wait for the pontoon, or fortunately now a bridge, or transport an ambulance to eventually come to a health facility. So that, I think, is an important issue in terms of prevention. If we are educating people about blood pressure, or about weight, about sugar, about cancer, examining your breast, examining your testicles for testicular cancer, breast cancer, they can communicate, they can send a photo to say, this is what it looks like, this is what my breast looks like, this is the lump on my abdomen, this is a lump on my thigh, I can't see very well if you're diabetic. This technology is coming into the fore, and we need to utilize our cellular networks and apps. There are apps now that can actually take a picture of your eye, and you can send it to an eye doctor that may be thousands of kilometers away to say you have diabetic eye disease, or you have high blood pressure related eye disease. So this is technology, I think, that's coming into the fore, and we need to embrace that in order to ensure that the distance no longer matters in terms of communication of information.